Yeah, I'm ready.
Okay, thank you so much. All right, so let's start off with the first question. What is your name?
My name is Earl J. Clement II, MD. So I'm a physician here at Methodist Midlothian.
Awesome, awesome. Thank you so much. Well, you answered the second question too, which is what is your title. But what specific type of doctor are you?
I am a hospitalist. I went for training as a family medicine.
Oh, okay.
I went to family medicine residency, and I do inpatient hospital care, which is basically internal medicine.
Oh, okay. Oh, awesome. That's great. So, what does a general day in the life of Dr. Clements look like?
Well, I usually get to the hospital about 7 o'clock. I go run through the patients, make the list to see the patients. Then I go to the ICU where I see the sickest patients. It usually takes me about 45 minutes to an hour to see them. Sometimes shorter, sometimes longer, depending on the severity of the patients and how many patients are in there. Then I usually go get a little breakfast. While I do that, I review the patients on the floor, med-surg patients who are not as ill, and then I see them. By 11 o'clock, I should have my discharges done, and we have what's called IPOC, which is the round where we update all the case management team, the nursing and the charge nurse, and everyone else, RTs. We kind of have a powwow together, discuss the patients so they can have a better way of being discharged.
Oh, okay. Is that like also where y'all do like soap notes? Or...
Well, no, soap notes are dictations.
Oh, okay.
So when you follow up patients daily, you do a soap note. Subjective, objective, assessment, and plan. That's a soap note.
Oh, okay. Okay. No, thank you for clarifying that. I saw soap notes when I was doing it was a remote area medical pop-up clinic, and I always wonder like where does that fit in?
Yeah. So when you admit a patient, you do a history and physical, then you do a progress note, and the way that people say do progress notes are SOAP, so you can remember that.
Oh.
Subjective, objective, assessment, and plan.
Okay.
And then you do a discharge summary when they're out the door.
Okay, a little sprinkle in that medical terminology. I appreciate that. Thank you. So your days are typically like a 9 to 5. Are you ever on call?
Well, it's 7 to 7.
Ooh, 7 to 7.
So as a hospitalist, most hospitalists work 7 days on, 7 days off. So you look at it, you got 26 weeks off, half a year off.
Well, that's true. That's true.
But half a week off. So typically, most people can leave a little bit before 7, or at least they're done with their work. We just have to answer calls until 7. But typically, a lot of us finish our work before then.
Okay. Then.
And then as far as call goes, nowadays, I'm a little bit older, so I started with paper charts, and now we're at electronic medical records. So I've had both.
Okay.
Both, but traditionally, when I first started, we would work the 24-hour call, and that meaning if we had to come in, we'd actually come back into the hospital. We had to be 30 minutes away, and then I was at a smaller hospital too. But now we have people that take call overnight, like a mid-level, which is a physician's assistant or a nurse practitioner, and then they see them, and I'm on backup call. So if they need me, they can just call the phone. I give them advice or tell them to admit this patient or not to admit this patient, or sometimes just to do the do not resuscitate orders because they have to be done by a physician.
Okay, I see. Okay, cool. Well, that takes care of what you're currently doing right now. Do you mind if I ask about like your undergrad experience?
Oh, sure.
Considering that we're PV alum, I was over in that, but I already spoiled it. But anyway, so where did you go to undergrad?
Well, I graduated from undergrad at Prairie View A&M University. Yes, and I'm very proud of my school. We had a great, outstanding medical program. In fact, I know several physicians that were in my class that are physicians, and know doctors that are dentists too that I went to school with.
Oh, okay. And did you complete like a traditional track or a non-traditional track?
A traditional track.
Okay.
But not traditionally. Yeah, I kind of stayed over. I transferred from Howard University. Could not afford it, and then had to stay an extra year. So
Okay.
Yeah.
That's fine.
Yeah, it was fine.
Cool.
I had a great experience up there, but it is what it is.
Hey, I understand. It's totally fine. So were there any programs you attended to help you be more competitive, like at Prairie View?
What I did, I took I think it's still going on. There is a program in Galveston over the summertime, and I did that as a junior. I got to meet a lot of good people. Got to get a taste of medical school. Just know what you're looking into.
Okay.
But yeah,
Cool.
Good program.
Did you pledge while you were at Prairie View?
Yes, I did. I pledged Kappa Alpha Psi, the Zeta Beta chapter.
Okay.
And in fact, it was two of my fraternity members who went to my medical school before I even got there. So it was two guys from medical school that pledged me.
Pledged you? Yeah. They were your big brothers.
Yes.
Awesome. Okay then. Okay. And what was your major?
I had a major in biology and a minor in chemistry.
Okay. What was the best advice or experience you gained from undergraduate school?
Oh man, it was so much. It was Dr. Tisdale, Dr. Brown. You can talk about Dr. C. Smith. It was Dr. Martin. These people were first class professors that really just well prepared us for our next experiences.
Yeah.
I can't. The biology department, Dr. Tisdale and Dr. Brown, they were pretty good, and told us that standardized tests are the way that they kind of weed out.
Yeah, and I will say those teachings still.
That's the truth.
But that's the truth, though, and they're so pivotal in just me continuing to pursue the journey. Because when I got there, I knew I wanted to be a doctor, and it really was Dr. Brown's advice that said, "I don't care what your upbringing was. If that's what you want, go for it."
Yes.
So
yes. Dr.
Awesome.
Brown is not pro fraternity, even though he is
right?
my fraternity
Hold on
brother.
now. And I looked when I found that out. I said, "Now, Dr. Brown, no." So that was a funny conversation. And I didn't have all the professors that you experienced. Some of them had retired by the time I got there.
Yeah.
But Dr. Brown still, like when I took biology and even immunology for graduate school, all of that knowledge helped. And Dr. Keaton was my professor for physiology and anatomy, and I promise you, like that information, the level of rigor that they give us, is definitely giving me an edge in graduate school. So, not to say that graduate school is not hard; it's still hard. But they do prepare you for that reality. So you're spot on with that. Okay, so transitioning to medical school. What medical school did you attend?
I went to Meharry Medical College in Nashville, Tennessee.
Awesome. So did you go to all HBCUs?
I stayed in the Negro Leagues.
No, that's awesome. No, that's fantastic. Because see, I've only heard HBCUs at the undergraduate level, so it's.
So there's Howard University. They have a law school and medical school.
Okay.
There's Morehouse Medical School, and then there's Charles Drew, that's affiliated with UCLA.
Okay.
In Los Angeles.
In California.
Mm-hmm.
Wow. Okay then, and then obviously Meharry.
Yeah, and I think Prairie View's trying to get a medical school. Dr. Brown's been talking about it for years.
Always. I probably will carry that dream on someday.
Yeah.
So, okay, so you went to Meharry Medical College. Well, I mean, this is not on my questions, but what was that like?
Whew. Man, I tell you, it was quite the experience.
Mm-hmm.
I love Meharry. It's people that I still talk to on a weekly basis. Some people maybe twice, 3 times a week.
Wow.
It was a lot of fun. It was a lot of camaraderie, a lot of learning.
That's cool.
Yeah.
So like just a nice community.
Oh,
like
man,
y'all going through it together.
We're going through it together. It's like the cream of HBCUs, and then we had people from all over.
Okay.
And it's a private school. It's not state school.
Oh,
So it's a little bit more expensive than a state school, especially if you're going to in-state school. That's a whole different price or whatever.
Okay.
But we had a great time. We had more fun than we should have.
No, just the right amount, because medical school is obviously stressful.
Oh man, oh my goodness, without a doubt.
Did you apply to medical school more than once, or just at one time?
Well, I applied to about 4 medical schools at one time.
Okay.
Yeah, and I think Meharry was the only HBCU
That you
that I applied to,
Okay.
and I think I turned down the interview at the other places after I got accepted.
Well, since you went to all HBCUs, what's your favorite thing about attending an HBCU?
The family. I mean, we go back to homecoming. It's a family reunion. I mean, we go. The people I know from Meharry, the Kappa chapter, which is of Kappa Alpha Psi, had their 100th anniversary, 2019, and it was so many brothers that just showed up, and the president of the whole fraternity came down. We had an event. It was great. It was great.
Wow.
I saw people from 1950s to 2000 teens.
Wow.
So it was quite the experience.
I love that. I love the historical aspect. Yes. That's nice. Okay. Can you recall what you were doing when you received your acceptance letter?
Oh yeah. I had just gotten home. It was in the middle of the day, probably on a Friday, and it made that weekend. It was about 2:00 when I got home from class. I saw the letter and I was like,
"Were you shaking? Were you?" Yeah. Oh wow. Wow. Man, that's crazy. Oh my gosh.
Yeah, I can still remember it. Yeah, we called the little house I lived in right off campus. We called it the box.
The box. Okay.
It was brown. It may still be there, but it was fun.
That's cool.
Yeah.
That's cool. What helped you be successful in medical school? Can you recall?
Oh man, it was dedicated professors. There's one person in particular, Dr. Prairie View. He's no longer with us, but a pathologist. He made his own notes and everything, and when I tell you that thing was dead on. It was quite a few people. Some have passed, and I'm a little older. But one thing about Meharry, they did everything in their power to have you ascend on to graduating.
Okay.
So, I don't know if other places would have shown you such graciousness and love and support.
Yeah, that's something I had been thinking about as I'm making my medical school list, because I have a whole family, and I need a medical school that can accommodate to a certain extent of like the emotional and social support of being a non-traditional student. So that's something I do like about UNTO Science Center, but I've seen at Meharry even Dr. King would reference. He was like, I've seen people with families, and they're very understanding. So that's top on my list.
Oh yeah.
So did you always know what type of specialty you would choose? I kind of fell into this specialty. Honestly, when I first got out, I wanted to be an eye surgeon, but things didn't work out for me like that. My board scores weren't there. But saying all of that, I could have went a lot of different ways too. But family medicine is something that you have options. You work from the ER, hospital, clinic. If you want to deliver babies, but there's so much versatility in family medicine, and you're primary care physician. That's the bread and butter of things. So it fit me. Okay, cool. Yeah, and I'm just noticing there's not as many African-American physicians in any specialty. You have some. There's a lot in like primary care and OBGYN and pediatrics, but it's just looking at the numbers of all physicians. And then how many were.
You kind of spoiled at Meharry because you know so many black physicians and black dentists. Because we had other races of people there too. Don't get me wrong, but the concentration you take it for granted.
Okay.
Really, you do, and just how many black physicians I have on my phone.
What a blessing though.
Yeah, it's a blessing because you have especially if you went to undergrad and your players together, because it was, when I got there, it was people from every fraternity, sorority that were there, bunch of people, and it was fun.
Wow.
It was fun, and smart people, dynamic people.
I love it. I love to hear it. Ah, that's awesome. Okay, let me get back on track.
Competitive too.
Competitive. Yeah, I mean,
but
definitely.
That's what.
Yeah. Yeah. No, I totally understand that. So, was there a specialty you knew you just did not want to do?
Oh man, I didn't want to do general surgery.
Okay.
And I really, as much as I like delivering babies, OB, that's all night, all day. A lot of times you can get around that by inducing them at a certain time,
right?
But it's. I think I got one that was good for me.
If someone were to ask you, like, why should I be an internist? Why should I work at a hospital? Like, what are some characteristics that you think would be ideal for someone to be like, okay, like this specialty might suit you better than?
Well, being a hospitalist, which you can do as internal medicine or family medicine, the thing about it is that you work a week on, week off. That's half the year off already.
That's true. That is true.
Then you kind of get to concentrate on healing someone in a short period of time.
Ah, okay.
And I've done clinic work in the past, and for me, the asking, have you taken your blood pressure medication? She's like, well, I keep on forgetting.
Yeah.
That,
I see what you mean.
Yeah. Not that there's anything wrong with that. Hospital's a little bit different, a little faster pace, and you got it can be tiring at times too. Sometimes during the winter time, that 7 to 7 is 7 a.m. to 7 p.m. is really challenging.
Yeah, I totally get that, especially with the sun coming up later, going down earlier.
It was working through COVID was challenging.
I was going. That was not on my list, but I did want to ask you, how was your environment and how you maintained your mental health and all that during COVID?
Well, I mean, I was there from like the beginning of it till like it kind of phased out a little bit. And the worst thing about it was that seeing people that I had taken care of for like 9 years just all passing away if they had any chronic illnesses. Really, I signed more death certificates in 1 year than I did in the previous 9 years at the same facility.
Wow.
Yeah, so it was, even then, people who were dying didn't believe it was true. So that was a pretty rough 2-3 years.
Yeah, I can imagine. I wasn't even in graduate school yet, or I took a break, but it was hard to see on TV or to like see on Instagram, and I know that's like very secondary to what your experience, but if it was hard to watch it, I just couldn't imagine like how hard it was.
It was one individual at the hospital who died because of a false negative test.
Oh no!
Not a false positive, but a false negative.
Man.
Several people got sick, but one person died who actually worked there.
Man, I'm sorry to hear that.
Yeah, but and a really nice guy. He'd been there for 30 years. So yeah, we took casualties too. You were risking your life.
Yeah.
Taking care of people, and people just don't understand that.
Yeah, and it was. I mean, I can't tell you how frustrating it was being at Walmart and see people who don't have a mask or just
coughing.
just be 6 feet distance, and they'll be like right up on you, and I'm like,
they're trying to. For some reason, they're conspiracy theories. They're trying to convince everybody else. If you believe something, you can believe that.
Right.
Just let me live.
Right. You can stay 6 feet away and believe what you want. Just let me, So before we get to the fun questions, I do have one last question in this regard. For someone who's aspiring to be a medical doctor, what is one piece of advice that you have for them?
Number one, you have to learn how to study. You have to learn how to study. You have to learn how to take tests too, because the way things are, you could know something, but if you can't test out on it, it's like you don't even know. And 3, you just gotta stick with it. You're gonna have bumps in the road. You will have bumps in the road. I know people with photographic memories, true, that it had a little tiny hiccup, but
Wow.
it was a hiccup.
Yes,
but
definitely.
you know, and that's what I can say. Just stick with it, and you're gonna know. You got to know that, like perfect example, the book that we had for embryology, we took a semester for that book to take the test. In med school, we had the same book. We took 3 weeks to do that and take the test over the book. So that's the pace.
The entire book.
That's the pace.
Okay.
So when you go in there, the pace is faster than you ever could think about it.
Okay.
Yeah. So just think about a semester. You take the test. 3 weeks, you do the same of that same deal.
Same deal. Wow. Okay. Okay. Then I'm thankful for my medical I'm thankful for graduate school right now because it's similar, but I'm starting to see.
But you can ramp up.
Yeah, I can.
People who went to graduate school had definitely an advantage.
Okay. Thank you. That's reassuring. Okay. So, do you mind answering just a fun round?
Sure,
of
no problem. I'm fun.
Okay. So, if you only had to wear one pair of shoe brand for the rest of your life, would it be like Nike, Jordans, Gucci or something?
I've never owned a pair of Jordans. But I probably would wear some Nikes. Maybe Adidas. I don't know.
Yeah.
Nike.
Yeah. Cool. No, Jordans are expensive.
No. I had the Adidas Top 10 before the Jordans.
Whoa.
Which tore up just like any other shoe I had before. So when the Jordan train came out in '85, I was like, no thank you.
Oh, okay.
No thank you.
You know what? I wish I had that teaching because I literally bought my first pair of Jordans. I'm 33 when I was 31. And literally 6 months later, one of them starts to squeak. And I said, what's that? And the other one is starting to flap open. I said, you know what? Forget it. I'm not buying these.
Man, Adidas Top 10. I have an aunt who's a ER physician. And when I was, going from the 8th grade to 9th grade, I stayed up there with her. Okay. And I kind of got my inspiration from her, kind of. And for that summer, that's what I got. Okay. So I'm like, and they tore up this, but they eventually.
They tore up quickly.
Just like any other shoe. And they eventually became the Ewings.
What?
Yeah. The Patrick Ewings. Yeah.
Okay. At the end of the day, shoes tear up.
Yeah. I could have stuck with the K-Swiss or the Pony.
Really? Those are good shoes.
Converse. I wear Vans and Converse a lot now.
Okay. And they are just fine. Yeah. They're just fine. My husband hates Converses. And I'm like, they're kind of, he's like, no.
Yeah, the support's not the same.
That's why I don't like them.
If you get the Vans with the comfy cush, that's
a good way to
running shoe out.
Work around that. Okay, favorite place to shop? And it doesn't matter if it's store or...
favorite place to shop is the record store.
Where is there a record store?
Well, here in the Dallas area, the best record store is called Doc's Records in Fort Worth. It's a little bit north of Montgomery Plaza. But Forever Young Records in Arlington, they have the biggest selection, but way a little bit too pricey.
Okay. So you love record store. Do you also have a
Yes, I do vinyl.
That's awesome.
I've had vinyl records I've had since the 80s.
Is the sound quality much better?
Well, it's different.
Okay.
It's different. Digital, I've listened to music on all types of formats, but I think vinyl has a warmth and a feel to it that you can get. Like if you've ever been to a party on loudspeakers while they were doing vinyl, that's the sound now. Digital is clear, clean, a little aseptic, but I don't know. Talking in medical terms.
Right.
But I've listened to a bunch of digital music, a bunch of vinyl. Really live music's the best.
Yeah, yes, definitely. Which my husband plays for a live band. He's got a performance tonight, so
Okay.
that's awesome. But I'll tell you about that off camera.
Okay.
What's your best method of relaxing, or just something you like to do to relax?
Oh man, I love swimming.
Okay.
Yeah, pool, steam room. Yeah,
That's cool. That's awesome. Have you ever competed in swimming, or is it just
Oh,
more of a leisure?
Well, I was a lifeguard.
Okay.
Yeah, that's still the best job I ever had. Worked at Waterworld, which in
Ah.
Houston, which is Six Flags, which is no longer there.
Oh, yes, swimming to relax. That's awesome. Okay, so this is like these are food. This is food, and I've noticed that this sparks a healthy debate
Mm-hmm.
in the African American community. Do you eat grits with salt or sugar?
No, I eat grits with bacon.
What?
You put bacon in the grits.
Bacon in your grits? Okay.
And some cheese. That's all you
Bacon
need.
cheese. Oh,
Bacon
okay.
and cheese, mix it up. You.
Yeah, you'll be
In
fine.
fact, I should have gave out my recipe.
I'll just say grits with salt.
Yeah. Instead of salt, you put bacon in it.
Oh, okay.
Yeah, you don't
okay.
salt. Put pepper and some
yeah.
cheese. Yeah.
Okay then. I promise you, I've had so many healthy debates
Yeah.
with other African American or Black people, and they'll be like, "It's with sugar. It's with
Yeah.
salt."
It all depends on who your grandmother was.
Yeah. Mine is with salt. And my husband's sugar.
Yeah.
So that's something we don't agree on. Sweet potato pie or pumpkin?
Neither. I don't eat.
You don't eat pie.
If I have to, I'll do a pecan pie, but
Pecan
it has to be a very you could almost see through the slice.
Right.
Yeah.
Do you not have a big sweet tooth, or it's just a
No,
pie?
I just go to appetizers, skip the dessert. That's just me now. Like a walnut brownie with some ice cream, you may be able to lure me in with that.
Okay.
Warm, yeah, that something like that ice cream, but maybe a lemon cake or strawberry cake, but none.
None. Okay. No.
Yeah, if I ate sweets, I'd be 100 pounds larger.
That's all right. And for anyone watching, eat sweets in moderation.
Exactly.
How about that? Yeah. Okay. Even though you're a doctor, do you still get holistic advice?
All the time.
Okay.
All the time. But interesting, one of my fraternity brothers the other day, I hurt my hand mounting this TV. Forgot the drill was on, and the next day I changed a bit, and my hands were this big. And he was like, "Hey, did you put some ice on it and swell?" I was like, "Yeah." He's like, "What I tell you? You didn't stop." It happens. I'll listen because you just never know. Someone can tell you.
Okay.
So I'll listen, but I'm not gonna. I'm not aloof like, "How dare you?" That's not me.
Now, I think I used to be like that, but then my mother-in-law, who swears by aloe vera, was like, put some aloe vera on a cut and it'll heal it. And now I'm all like, aloe vera. Of course, takes medication, but aloe vera for sure.
Yeah. My aunt, she doesn't really even. She just practices holistic medicine now.
Oh, wow.
She's in Ohio. I want to say Cincinnati.
Okay.
And that's what she does. I mean, she does that and getting people off of drugs by that. But she pretty much, she was working in the ER telling people to get turmeric. I'm like, these people are not going to listen to that.
Okay. Oh man, that's really cool. And your aunt. Is there anybody else in your family who's a medical doctor?
Not at this time. If they are, they're coming. They're applying and trying to come through the ranks.
Okay. That's encouraging. Yes. That's really awesome to hear. Well, that's all of my questions, because my husband was very adamant about don't ask more than this much, and you don't want to take all his time. So that's all the questions I have, and I just want to thank you so much for taking the time to meet.
Hey, it was my pleasure.
Yes, sir.
All righty.
Thank you so much.